Hi friends, hope you're doing well. I'm Dr. Milind. So a lot of PG aspirants would be joining their junior residency through NICT and NEET PG counseling. So I just wanted to share a few words of wisdom and few advices with all of you because this junior residency is a different ball game. As an intern and as an undergraduate, you had a different life, but junior residency is different. You have a lot of responsibility, you learn a lot of things, and this is a new chapter of your life. So I just wanted to share a few advices with you. First, don't go with the luggage in your head. A lot of students do that mistake. We do a lot of background research about the college that we have opted for or we got in the counseling. We do a lot of research about the faculty, we do a lot of research about the seniors and everything about the place itself. And sometimes there are a lot of negative things about the place, like the place is very toxic, the workload is very heavy, the weather is not very friendly, the academics are not good, or the teachers are not great, or the patient load is not good enough in some colleges. So these all kind of things are there. But when you have this luggage in your mind, and when you join certain residency, for example, if you hear a certain place is very toxic, so you become very sensitive to even a smaller things, that because you have already been primed with this information already. So you start feeling like that, this place is very toxic and I don't think I can make it here. Second, also about academics and about place, everything. So you become sensitive to everything that happens. Also, it is always said that when you think about such things like again and again. So for example, before joining your residency, you are thinking about the toxicity of this place and how will you survive. So already some of you might be having these panic attacks and anxiety. So you are having it now. Once you join it, suppose if the work is tough for you, again you will go through the same. So actually you will go through this situation twice, once in your mind and once in reality. So things will be difficult for you. So why do you want to go with that mind? I'm not, the thing is, I'm not trying to scare you. We all know the reality of the all the government hospitals and the reality of the kind of workload we have and the kind of overburden Indian medical system is. But with the kind of hard work that we have achieved this, so sometimes I just trying to put some positive things in your mind. The second thing is, it is not going to last forever. Once you join, what I have experienced through my journey as well. Once you join as a junior resident, the first year is definitely hectic. You have to do a lot of sampling, and actually you will be the connection between the patients and your seniors. So a lot of time you have to face the patients, and sometimes it becomes very tough. But trust me, it is not going to be that tough. Once you enter into second year, it becomes a little bit less hectic. In the third year beginning, you will be having submission of your thesis, and then you will be gradually relieved for your exams, and you'll have a lighter duties. See, during my residency, we used to have kind of every third to fourth day duty, but as a SR now, we do like 3 duties a month. So that is how you progress. It's not like in a junior residency, when you start, sometimes that thought come to your mind that this is how my life would be and this is how will be forever. No, once you progress through your residency, the lives become easier. Also, the life is what you want to choose. Every branch has an emergency aspect and a OPD aspect, like a less hectic kind of aspect. So it's up to you that which path you want to choose. So don't go with that thought in your head. As I said, that things will get better with time. Next, whenever you want, in residency, there will be times when you'll be feeling depressed. Negative thoughts will be coming to your mind because you'll be having long working hours, and it's not easy to work so long. So it's very difficult sometimes to connect with your family, connect with your friends. So it's obvious that you start feeling lonely. Also, once you come back from duties, you're very tired, so you just want to sleep. But I'll say, whenever you have such thoughts coming to your mind, talk. Open about how you feel, because a lot of students, they isolate yourself. A lot of resident, once they start feeling that, for example, some North Indian students, when they go to South, because of the difference in the language, some South students, when they go to the North, the difference again in the culture and the language, it's really difficult. It's really difficult for them to get adjusted for food and for everything. So what I'll say, with time things get better. I have seen a lot of students, even people from South, literally they settle in North. People from North, they went to South and they settled. See, nobody talks about these things. Nobody talks about positive. Yeah, there are negative things as well. But here, when you start this journey, I just want to put forward the positive side of it. So once you go there, once you start feeling that, just talk. You can make new friends. It's not like if you're not able to reach to your family or your friends. There are always new people who have joined with you. There are seniors. Sometimes maybe some seniors you will not be that approachable, but there will be always someone who will be there for you to listen to you what you want to say. But you have to approach at least for that. Also, don't isolate yourself. It is said that sunlight is a very good it's a very good for depression. I mean, if you want to get out of the depression, sunlight is a kind of treatment for that. So you will feel that more you isolate yourself, more you spend time in your room, more depressed you'll get. So whenever you feel so, just get out of the room, just get into sunlight, just have a walk, just talk to your friends, talk to people. It's okay. You don't have to know a lot of people to talk to you. There will always be someone. Don't worry about that part. See, resident, let me tell you that this is amazing, and you'll be having a great junior residency. You'll learn a lot of things, and you'll become a great physician that you have always aspired. Just have a positive mind. Just have a positive. And lastly, a lot of students ask me, sir, I always have this confusion that whether I should join. There is one college which is very hectic, and there is one college which is has a less hectic and a low patient load. So which one should I join? Because a lot of people say that college which is very hectic, it has a lot of exposure, so you will learn a lot. But I'm scared of the toxic work, and the other college which is less hectic has a less exposure. So I am just scared that maybe I will miss out on something. So what should be my approach? See, I'll tell you what one of my faculty teacher told me during my residency. See, you as a medical student, as a medical resident, we are more experience we get, better we become in our life. More we see things, because it's not like in the textbook. We see the patient and we learn from the patients. Patients are our teachers. So more time you spend in the hospital and more time you spend with the patients, the more you'll learn. So there is always this thing, you will have you will have a hectic life, you will have a work burden, but you have to decide that when you want it. So some people who have done their junior residency, like first, second, third year of junior residency, in a hectic place, so they learn, they get that exposure in their residency. So they become very confident in their SRship, and they can do work in a less hectic place where they don't need any more exposure, and they can just use their experience. The people who have worked in periphery, like newly opened colleges, and who don't get that much of exposure, and who feel that so they don't have that much of confidence because they have seen less number of cases. So sometimes these people, when they become a senior resident, so when sudden responsibility will come, they will look for that experience. So then they have to choose, sometimes go in a hectic place and get that kind of exposure. So you will have to choose, like someday you'll have to choose a hectic life. You have to know that you want it now or you want it later. So that is my opinion on that. So guys, I hope this video will help you, and I wish you all the very best for this new chapter of life. Take care of yourself, and I wish you all the best.